right.
You are now live.
We are now live. It's Senator Brock. Can you hit got it on that side?
Sure.
I've got it on my screen and we're ready to go. Okay, we are live. This is Senate Finance. This is April 12th, I believe. I know it's Wednesday. And we are rewriting our calendar today, trying to work through H510, which is the child tax credit and Social Security income that has come to us, and trying to get that to coordinate with the budget and the revenues in the budget. But first, we're going to do H655, which is really a formalization of everything we've done with telehealth, telemedicine. We've let down a lot of the traditional rules and regulations, and this is kind of bringing us back in to having some structure and some control, and there are a couple of fees. So Jen, I'll let you, I think you and then Lauren and Nolan we've got. Okay. So 20,000 foot thing.
Great,
here.
that was going to be my question. All right, good afternoon. Jen Carby from the Office of Legislative Counsel, and we are looking at H655. The title tells you a lot. It's an act relating to telehealth licensure and registration, and to provisional licensure for professions regulated by the Office of Professional Regulation, OPR. So Section 1 sets up a whole telehealth licensure and registration system for basically for healthcare professionals who are licensed, certified, or regulated in another state, and allowing them to get either a telehealth license or a telehealth registration to provide those services on a limited basis through telemedicine here. And so by telemedicine, we talk about telehealth, we're talking about telemedicine, which is like we do on Zoom, the live audio video interaction that is over a HIPAA compliant connection. Telehealth also includes store and forward, where audio or visual or other materials are transmitted to a provider to be looked at not in real time with the patient. And then audio only telephone. So just the telephone version of providing healthcare services without the video link. So it talks about the types of healthcare professions that are included. It's a pretty expansive list of the healthcare professions that the state regulates. So then there's a telehealth license. That one allows a healthcare professional who's licensed out of state to get a telehealth license to provide healthcare services using telehealth to not more than 20 unique or different patients in Vermont during the 2-year term of the license. It talks about what they need to provide to get that license. And then the fee for the telehealth license is 75% of the renewal fee for that profession. So basically what somebody who's fully licensed in Vermont would pay on a biennial basis every 2 years, 75% of that renewal fee for the profession is the telehealth license. Then there's also a telehealth registration, and that one allows the out-of-state provider to provide services to patients in Vermont using telehealth for not more than 120 days and to a total of not more than 10 unique patients or clients over that 120-day period. And the telehealth registration fee is the lesser of either 50% of the renewal fee for that profession, or the application fee for a full license for the profession. And I think you may hear from some other witnesses about the relationship between those fees and what it might look like for different professions. And this one is not renewable. So telehealth license can be renewed. Telehealth registration cannot be renewed. You can only get it once every 3 years. And then there is, finally, from the fee standpoint, there's also a transition to licensure and fee credit. So if somebody provider wants to see more than 20 patients over a 2-year period, then they can always apply for a full Vermont license, which is what they would do what they do now, or what they had done prior to COVID. I think there's some feedback going on.
Hold on, we got technical difficulties. You need to leave the meeting. Okay.
Okay.
My apologies.
So if they decide to, if somebody with a telehealth registration decides to apply for a telehealth license or a full license during the time that their telehealth registration is in effect, or within 3 years after the effective date of their telehealth registration, then the amount of their fee would be credited toward the fee for the either a telehealth license, if that's what they're going for, or the full license, if that's what they're going for. And similarly, for someone who gets a telehealth license, if they want to apply for a full license during that 2-year period when their telehealth license is in effect, then the full amount of their fee paid for the telehealth license would be credited and applied toward the application fee for the full license. So people can kind of level up their telehealth registration or license if that's what they decide to do during a particular period of time. Then there's a number of other provisions that kind of lay out all of the application and enforcement processes. Section 2 of the bill allows the director of OPR to issue a 90-day provisional license to someone who has completed an application for full licensure. And this is all across all OPR regulated professions, so not just the healthcare professions, but it's for somebody whose eligibility for licensure is contingent on getting acceptable verification of their license from another place where they're licensed, or they're waiting on a background check, or they're an active duty member of the armed forces who's assigned to duty in Vermont, or that person's spouse. And it lays out, there's just in exchange for getting the provisional license, the person gives up some of their procedural rights if they're denied, and their recourse is to apply for the regular license, go through the regular process. So just to recap, especially as it relates to this committee, telehealth licensure and telehealth registration, 75% of the renewal fee is the fee for the telehealth license, that broader 2-year telehealth license to see up to 20 patients. And then for the telehealth registration, it's the lesser of 50% of the renewal fee for the profession, or the total cost of the application fee for the profession, whichever is less. And that is to see up to 10 patients over a 120-day period. I will stop there.
Okay, committee, any questions about what we're doing? We're basically formalizing what we did during COVID and allowing telehealth on a limited basis to professionals licensed outside the state. But if they want to really expand with inside the state, saying, you want to go over these limits, you have to get a full licensure in the state of Vermont.
Madam Chair, I assume that we're going to take testimony on this?
No.
We're not. Well, then the question becomes one of, if they're qualified to perform this service because they're licensed in another jurisdiction and they're enabled to perform it for 20 patients within a certain period of time, why is it not broader? Is there some reason other than the desire to collect revenue why that license isn't allowed for a larger or less limited group of patients?
Okay, I'm going to look to Lauren. Lauren Hibbert is Lauren.
Hi, good afternoon. For the record, Lauren Hibbert, Director of the Office of Professional Regulation. I'll jump right to that question and let you know that over the summer and the fall, we facilitated and gathered a working group related to telehealth provided by out-of-state providers. This was a task that was given to us by the legislature last session. I think recognizing that telehealth was here to stay and probably will continue to grow, that COVID has radically shifted the delivery of healthcare and has made state lines less noticeable in the healthcare world. That was Act 21. We worked with a group of stakeholders that was very diverse. It included all of the healthcare professions, their associations, the hospitals, the the insurers. We heard from educators, the UVM network and the state college network related to this issue. And we came together with a group of about 60 stakeholders with a uniform recommendation, which was this telehealth registration for a limited period of time, limited patients, and then the telehealth license also for a limited number of patients. And the reason why these restrictions were here is because the full license is available. It's always available. And what the working group really acknowledged was we want licensed professionals to have a significant nexus to the state. And if you're going to have more patients, then you should pay as much as an in-state licensee. We didn't want to favor out-of-state licensees over in-state licensees. I think for this committee, you're very aware we're a siloed special fund. So we don't receive general fund. We're funded only by our licensee dollars. So we need to make sure that the funds that come in support the program. And we didn't want in-state licensees to subsidize out-of-state licensees. So if we allowed for unlimited amount of patients, then we could anticipate that that would be more work for the offices responsible for overseeing those professionals, either through complaints or questions. And so we wanted to limit the number of patients in an effort to limit the complaints or questions. And therefore we were able to offer a reduced fee, which was also of importance to the working group because we want to make it easy for out-of-state professionals to practice telehealth here while also creating appropriate constraints on that practice. Don't know if that
means, for example, that a person who is licensed to perform telehealth could obtain a Vermont license that would allow an unlimited amount of telehealth, but could that person maintain his or her office and his or her telephone or telehealth practice outside the state of Vermont entirely? Or would they be required to, in effect, open an office here in addition to paying the fee?
No, they would be able to have their office outside of the state, conduct their entire practice out of the state, but have an unlimited number of telehealth patients if they had a full Vermont license.
And what's the cost?
And that's happening currently. That was happening before COVID. That's happening now. That is a business model that's out there. That is happening.
What's the cost difference? What would it cost a person for the telehealth license on the one hand and the full practice license on the other, typically for, let's say, for a physician?
For a physician, I can give you an exact number. I think that for a physician, sorry, I just have to look at a document. For an allopathic physician, the application fee is $650. For a telehealth license, meaning they can see 20 patients, that's 75% of the renewal fee. The renewal fee is $525. So the telehealth license would cost them $394. For the telehealth registration, it's 50% of the renewal fee or the application fee. In this instance, the application fee is higher. So it's 50% of the renewal fee, which is $262.
And in terms of qualifying that person who is the out-of-state provider, are there any other administrative barriers that would impede an out-of-state person from getting that in-state license to perform telemedicine exclusively at a distance? Are there any things like in-person requirements, any other exam requirements that are different that would apply to those people?
A piece of this bill allows professions to do rulemaking profession by profession, recognizing that included in this bill are a wide diversity of healthcare professions, everything from physicians, as you've mentioned, but also physical therapists, also naturopaths, also veterinarians. Veterinarians wanted to be included in this bill. So we wanted to have the authority to do rulemaking that may have additional requirements. In the working group, obviously those rules will go through the administrative rulemaking process and have appropriate oversight by the legislature and input from the licensed communities. But in the interstate working group, we did not discuss having an in-person requirement attached to telehealth. We were discussing primarily making sure that people could provide telehealth. We did discuss some providers needing to connect to primary care providers or trying to get pertinent information to the relevant other care providers for that patient. Again, that would be defined by in the rulemaking process. That would be something that we would talk about. Is this a requirement of the out-of-state licensee who's providing telehealth that they need to provide regular updates to the patient's primary care? You know, the state has a lot of interest in having an electronic record for a patient where that providers can all access, understandably. This disrupts that some, and so there was concern about making sure that that information was tied back to the people who would have access to that record.
Okay. Any other questions? I guess we have questions for Jen. So Nolan, up, Senator Pearson.
Yeah, thanks, Lauren. I just curious that the 75% and is where a lot of these fees are pegged, and then some of them are half. Is that? I guess I can understand that we would want to charge a smaller fee for somebody just doing a little bit of business, but is it a fair representation of what the work involves for your office?
I think it is, and it's balanced with our fear of losing revenue. So currently people are getting a full license, and we know that people are going to switch to this telehealth license. So we don't want to unintentionally create a deficit in our office more than we already have. So, which we have a deficit in our office because of COVID. We've had a dramatic loss of licensees, partly because of COVID burnout, we think, and also because of the flexibilities that have been in place. So we want to be careful about that. This is still an application. We're still going to have to review the application. So in terms of, upfront work and costs, we're going to try and make it streamlined with verification from the other state and not collecting as much information. So if you were an osteopathic physician applying for the first time in our office for a full license, we would get your transcripts and your exam scores, and if you are licensed in another state, your verifications. In this model, we'll be looking primarily at your verification from the other state. So in some ways, it's a little bit more streamlined, a little lighter application, but it still will require staff time and staff, a staff assessment of whether you're qualified. We also will need to do rulemaking for all of these programs related to this. It is a large task for all of the profession types. It's 48 different profession types at OPR, just for scope and breadth. So I do think that over time, this may be a place where we adjust the fee to make it lower. We really don't know how many of our full licensees we're going to lose. So this is the way that I talked about it in front of Ways and Means on the House side this is our guesstimation of how many folks we're going to lose and our best estimate of the fee that we need to charge to make sure that we don't go into a deficit. But that's just like all of our fees, we need to be looking at that year after year and make sure that it's still appropriate and at the right level. And so that this adds a layer of nuance that OPR is just going to have to adapt to for future budgetary reviews.
There is an appropriation too.
There is an appropriate.
Yeah, to help with standing it up.
Yes.
Okay, so I'm going to go on to Nolan, who will tell us about the money.
Great. For the record, Nolan Langwell, the Joint Fiscal Office. I believe the reason it is in your committee is because there is a revenue reduction. So that's what I'm going to briefly talk about. I worked on this with OPR very closely. A lot of the estimates are based on the information they provided me and the methodology, and I reviewed it, and it's based on the best information we have available. So currently we know there are about 9,600 licensed out-of-state providers. With the way that we came up with this estimate, which, by the way, we estimate that it would be a loss of $195,800 over 2 years. These are 2-year licenses. So in fiscal year 24, it's estimated there'd be about $77,000 reduction in revenues. And in fiscal year 25, we estimate there'll be about $118,000 reduction. This is based on information we know. So currently what we know is how many out-of-state providers are currently buying licenses in Vermont. And the estimate basically takes a percentage of those folks and says how many of those folks are going to move from the current license into this new license. OPR estimates that it's about 25%, which I think is a fair estimate. It could be higher, it could be lower, but this is the best estimate we have at this time. What we don't know is how many out-of-state providers are currently practicing through the telehealth only. So this is the current registration where they're able to practice. And so what the estimate does not do is make an estimate of how many of those folks would buy new licenses. So the estimate could be lower in terms of we could have more revenue, but we don't know. So this is a very conservative sort of worst case scenario. I think that's really all I have to report on that, unless there's questions, in which case I might wind up tag teaming with Lauren.
Okay, committee, any questions? I think what we're hearing is that this is their best guesstimation. We were trying to determine what human beings might do, and that's difficult under the best of circumstances. So the switch might be that we're seeing people who are fully licensed here switch to the part. Is the telemedicine only, there's a limit, right? One can't be renewed. Do I remember that correctly, Jim?
Yes, the registration, telehealth registration, the one to see up to 10 patients over 120-day period, can only be can't be renewed when it ends. You can only get that telehealth registration once every 3 years.
Lauren?
I just wanted to add that in Ways and Means, they added an important amendment, which is if you've paid for the registration and you decide to bump up, meaning to the telehealth license or to the full license, then you'll get credit for the amount that you've already paid. So I think that's an important amendment that Ways and Means added, really incentivizing people to stay and work in Vermont. If they decide that the licensure solution they chose first isn't the right fit, they can go to the next solution. And this really gives the out-of-state providers the Goldilocks solution. They can choose which is the right size license for them based on the type of telehealth practice they're going to do, whether they want the telehealth registration, the telehealth license, or the full license. They get to make that choice.
Okay, so committee, our jurisdiction of the fees, which is 75% of the renewal and then 50% of the renewal, or in this case, the application fee is more or less the application fee of.
It would be if the application fee is less than 50% of the renewal, whichever is lower.
Whichever is lower. And if you do that and it doesn't work, you can get a credit towards full licensure or the next step up. All right, committee questions, motion. Senator Harding.
I will move that the committee support H655 as, did the Senate Health and Welfare Committee amend it?
No.
It's just as presented to us.
As presented to Finance.
Okay. Is there any further discussion on this one? If not, all those in favor say aye. Opposed say no. I'm hearing that is 700. And Senator Hardy, do you wanna,
Sure.
are you reporting this one on the floor?
No, Senator
Lyons is, I thought so, but you can,
Do the finance.
you can do the finance report.
That'll be
Okay.
hard.
Yes, good. We're starting out well. We're 15 minutes, 5 whole minutes ahead. So committee, for the rest of the afternoon, we're going to try and reach some concurrence on 510 and tax credits, and I'm trying to figure out some of what the difficulty is, and that is that the language is all reversed. That usually we're being asked to raise money, and this year we're talking about giving it back in the form of tax credits. So I got very confused when Graham was talking about tax revenue, because we weren't doing anything. So, I think we were trying to get Representative Ansel here because the question came up as to why the House did something this large. What were they thinking? Why didn't they look at the EITC? What was going on? And Faith, are we notifying Janet? Do we?
Janet will be with you at 2:15.
At 2:15. All right, maybe. We have Commissioner Brown with us. Commissioner, you're our first witness. We've been doing witnesses remotely.
I apologize if you expected me remotely. I was in the building.
That's fine. I know you were in the building.
Senator
Yeah.
Cummings,
Yes.
when Representative Ansel shows up, she only has a very short time. So I'm hoping that you can either wait for her or interrupt Sean Brown's testimony.
Okay, Commissioner, question for you was, we had done a social security exemption, I'm watching a bell up there. And then the child tax credit, and I don't remember who asked the question, but there was a concern that there might be an interplay, that if we gave you credit, would that count against your income to get the social security credit? And just, if you have any idea how that might work out, that will kick it to the tax commissioner.
Well, in terms of the programs we run, it depends on the program, and then it depends on how the tax credit is provided to the family. If it's like an ongoing or like a lump sum at tax time, and it's a refundable tax credit in that way, all makes a difference. For most of our programs, we have the ability for like LIHEAP and Reach Up to minimize the impact on the households because they're block grants and we have flexibility in how we structure our programs. When we think about an impact on the families we serve in our programs, it's really the SNAP program at the federal level, 3 Squares Vermont. It's all 100% federal benefit, and it's all 100% federal rules, and we have very little flexibility in how we can maneuver within those rules and change them. And so if it's paid out as a lump sum, it has the least impact. It would count in the month that is paid out to those families. If it is paid out as a credit every month, like the federal benefit was, there was a federal exclusion for the federal benefit, but there wasn't for any state type benefits. So it would count as income, and we have some scenarios that we could provide the committee to show that impact. It impacts households at the higher income on those programs and households on the lower income of those programs. So it depends on how you're structuring the program and the payment.
But in general, a lump sum.
Is a one-time lump sum is better than an
And
ongoing.
ours will be small enough, unlike the Fed, so if we spread it out over 12 months, it wouldn't be a lot,
And it would only impact a month of receipt, not the rest of,
not the
because
rest.
it's a one-time, non-recurring.
Okay.
Is how we-
So the preference, if I mean, the preference is a one,
Yes, yes.
yeah, and it's only SNAP, it wouldn't impact
We
you.
can, we have the ability, depending on what the committee and the legislature chooses to do, to mitigate any impact for those other programs through our rule process, so.
Okay, Senator, then you got a quick question?
Yeah, just if the recipient gets this benefit in April or May when they get their tax return, I just want you said it'll impact that month. But do they then have to reapply to be back in the system in June, or is it just seen as a blip in our system?
We would certainly, we do have the ability to ask the federal government for waiver in this situation, and we certainly would do that, but there's no guarantee that we would get a waiver or what the waiver would look like. So we would certainly try to mitigate impacts on the family of having them flip on and off the program. And so we would certainly look to mitigate the, so families don't have to reapply in May. We would certainly want to do whatever we could do to mitigate the impacts to the extent the federal government would allow us. And we would certainly, depending on what comes out, we would certainly try to seek a waiver from the federal government to even try to exclude the one-time lump sum, but there's no guarantee it would be granted.
True.
Thank you.
Okay, thank you. Any other question? Commissioner Brown. Thank you.
Thank you.
Representative Ansel, we expected you to pop up on the screen.
I know, oh, no, I wanted to come and say.
You wanted to come see us in person.
Yeah, so nice. Nice. I've been in here a long time.
Okay.
So for the record, Janet Ansel. I don't know if you want me to say something or you want me to respond to questions.
I
I'm
think
happy to
the
do whatever
basic
you want.
question that came up yesterday is, what were you thinking? Why did you choose the tax credit over, this form of tax credit? Why did you choose to go up to $200,000, per family? What really was your rationale or your line of thought?
Why this bill? So I think a number of people were thinking about a Vermont-based child tax credit. It wasn't unique to me. So I can only tell you what I went through in terms of thinking about it. I know when the federal government did their child tax credit, the $300 per child per month, I remember thinking, what a brilliant idea, just to put money in people's pockets. And so, and I, like everybody, I read the articles about the impact and the impact on poverty, the impact on brain development for babies. There's, all these positive things. And this truly dates me, but I'll just do it anyway. When I was in social work school, which was a really, really long time ago, was the era when we were still talking about the guaranteed annual income that President Nixon talked about. And that was part of my social work sort of training, was thinking about what a guaranteed annual income would actually do for families. That didn't happen. We've done some other good anti-poverty programs since then. Nixon abandoned it, but it was his idea. So just all those things came together, and then I happened to stumble on an article, and I was just stumbling on it, that talked about other states that have done a child tax credit. So, I thought, gee, maybe this is something that we could do. Revenues have been surprisingly strong, actually. Realized that we have a ton of one-time money, and that's supplemented a whole lot of what we've been doing with regular revenue and ongoing expenses. I know the one-time money isn't going to last. But I also had, I believed, and it turned out that the administration was sort of in a similar place, that there was room for a tax cut. And I wanted to be sure that if we did a tax cut, that it was directed at families and directed at families with young children. So all those things sort of came together. It turned out that there were other people who were thinking along the same lines. And I think principally in the House, but so that's how the bill came together. When I originally put it together, so I had a target of about 50 million. That was what was in my head. When we originally did the bill, it was 400, we had income caps of 400,000 for violent joint, 200,000 for single. For a lot of reasons, 400,000 felt like sticker shock to a lot of people, seemed like a lot of money. So one of the things that we did fairly early on is that we changed the 400,000 so that we didn't make a distinction between filing status, understanding that a household is a household, and the fact that you have two income earners or one income earner doesn't really change the amount of money that you have available. So we dropped the 400,000 and just went to 200,000 overall. And part of the thinking behind having what is admittedly comfortable income for a household with, let's say 4 people in the household, 1 or 2 children under 6, a couple of wage earners, is that with a program like this, I felt that it was important that there was sort of general buy-in, that it wasn't, we have some really good low-income programs. I think the earned income tax credit, which you and I have done some good supplementing or increasing of that. The House and Senate working together has done that. That's a great program, but it is focused on a particular sector, and of course it requires that you have earned income. And I just felt this is looking at a slightly different slice, and that it would have more sustainability if it was more broadly enjoyed. And it's also a couple other factors there is that I think you've seen this data, but the kids live generally in lower income households. That's partly, if you think about it, young kids, I don't mean middle-aged kids, but when you think about it, you typically have your kids when you're starting out working, your income is going to be lower. As your kids get older, you have more income. And so I think we've got a chart, if you haven't seen it, I'll get it to you, that shows that kids, that the young kids are in,
we saw that.
tend to be in lower income households. So you didn't save a whole lot of money by dropping the income level. You knocked off a lot of people and a lot of buy-in, but you didn't actually save a lot of money. So that was one of the pieces. What else? Did I answer the whole question? I'm not sure I did.
I think so. Committee?
Yeah.
Another factor we looked at is the age. It goes up to 6. Did you have a logic on 6?
I had this target in my head of 50 million, and the 6 was 50 million.
Got
it. Actually, the rationale, and so it goes up to age 7. Actually.
Yeah.
I can, not going further than that. Some people in the House wanted to have any age. Some people wanted to have any income. Some people wanted to have lower age. Some people wanted lower income. So we're kind of finding the middle spot. But by the time you go to school and you're out of daycare, the costs of having children, I think, shifts a bit. So this is not intended to substitute for the support that we give families with childcare, but clearly that's a cost that gets smaller as kids enter school. To be honest, I probably would have been okay if it meant 6 and under rather than 7 and under, but numbers.
Senator Gray.
So did you model, I think, one of the concerns, I'll speak for myself, one of the concerns I had, although it was shared with me, was around given a median income of in the state of roughly 62,000, why were we taking a benefit to multiples of 62? And could we, by basically making the slope steeper, make it progressive, make a steeper slope, afford truly lower income providers a larger benefit that would be more meaningful to them than sort of a more general benefit to across the board. So did you model that sort of larger benefit, steeper slope?
So we did model a larger benefit, and I think original thing I asked Graham to model was, I think ended up costing 150 million, and I thought maybe we could have that money to do that. So yes, we did do that. There was something about the $100 a month that I liked, frankly, and the $1,200 a year for somebody at a lower income level. And I don't need to explain the math to you, because I know you all know it. That a flat amount at a lower income level has greater benefit than a flat amount at a higher income level. So there's a progressive element built into it because it's a flat dollar amount. And we don't distinguish, for example, on the personal exemption. We don't use this sliding. This is, to me, more like a personal exemption than it is like some other things, and we don't use the sliding scale with that. If the benefit is, you know, if you have an income of 20,000, $200, it's a huge difference to you. If you have an income of 60,000, it would be really, really helpful, but clearly it's not quite the same impact. So it is, I believe it is progressive, that we have other, you know, the much more expensive, clip in it, which is one of the problems with it. So it just felt like, given our whole tax structure, that this added something to the mix that I felt was important. And rather than using the tax credits and the kinds of programs, rather than increasing those programs, it made sense to me to do something that kind of attacked problems in a slightly different way.
I have a quick follow-up. So as part of that sloping all the way up, or benefit out to 200,000, that just a design philosophy, like because you're engaging the broad public, that it will be a better supported program.
That is a piece of it for me. I don't think that's the driving piece, but that's a piece of it. And for me, the driving piece is to focus on young kids. You know, one of the things we talked about a fair amount in the House, and I'm hesitant to talk about it because I have no empirical data to back it up, but I'll mention it anyway, is that we really talk about trying to attract young families to the state and get young families to stay in the state. And it seems to me that a substantial child tax credit really lends weight to that. If it's complicated, phases out, if it, you know, depending on if it's too small, I think it needs to be enough that people will pay attention to it. And I don't know, I think that the reason there's no data to support it, it is a message. It is saying we're a state that really values families with young kids, and we value them enough that we're going to put money behind it. And I do think that is important, and that argues to me for not having the income cut off too low. We desperately do need families in the state. We need families with young kids. So I think this helps support that, and then at the same time, it improves the circumstances for young kids in very significant ways. It's a good, really good anti-poverty program, and it's good for people who are food insecure. It's on top of the other programs that we do, so it's not taking anything away.
Okay, Senator Srirajan, that's it.
Jan, I think you mentioned that this comes on the heels of a federal program, and also that you looked at the large surplus we had at one time monies. Is there any reason to think that this, what you posed is that this is not going to be an ongoing program?
No, this will be ongoing, but and one of the benefits of it in terms of tax credits is that it won't grow. Even if we're successful in getting families to stay here, if we attract some families, it's not going to grow appreciably because it's based on the number of kids under a certain age. So I'd love to think that it would grow, but it's not forecasted to grow. Yes, no, this is intended. This is not using one-time money. This was using what we identified in the House as ongoing money, and it was fully funded in the House budget. The House budget accommodates the full 48 point something million, or 49, can't remember, because we added the social security thing late.
Because I mean, we are dealing with other programs where we're continuing weaning ourselves from COVID. And I was wondering if that was a thought.
I guess I just feel that this is something that maybe we learned from COVID, that this was because the federal program was in response to COVID. But as I said, I think it was brilliant, and I think it really, really helped people.
Okay, Senator Brock and then Senator Pearson.
I've got two questions that are probably very different. The first is that the administration's proposal, the governor's proposal, which used essentially the same total amount of money, was very different in that it was broken down and it was much broader and included help for a variety of groups across the board. And I assume you looked at that and then settled on this. Can you kind of give me the thought process that went to your decision to accept that and reject the rest?
So it's not entirely coincidence, but sort of coincidence that we came up with the same dollars. I developed this program before I knew what the governor was going to put in, and introduced the bill before they came into our committee. I like a lot of the things in the governor's proposal. I'm a big supporter of EITC. Not the child dependent care credit's never been used a whole lot, but it has potential. So, I got that. But my observation is that when you take a chunk of money and you sprinkle it around, nobody really gets a benefit. And I was really looking for a way to really have an impact. And this felt like, for once in all the years that I've been here, that maybe there was enough money to do something that had a big impact on a part of the population that we have got to encourage and support, which is young kids and families with young kids. So it was, I guess that's the answer to the question is that it felt more important for me to do a single thing with a very big impact when we had a chance to do it.
And then the second question was, you just chose tax credits as the vehicle to do this.
Oh, I know.
But, did you look at alternatives, including cash payments?
Well, in effect, this is a cash payment because it's a refundable credit.
But in terms of how the person goes about getting it, the mechanics and so on, as opposed to where we had the federal program in which they got a check in the mail and they didn't have to do anything.
We did look. We would have loved to have found something that that we could have done, if not monthly, 4 times a year. The way we've written the bill is because the tax department asked us to do it this way, is to do a single payment the first year, and then after that, do it in 2 separate payments. If this is successful and it develops its constituency, I think over time we'll be able to divide those payments up so that people will get them more frequently. But they were unable. They just said they couldn't do it, and it would cost. And I am, having been a tax administrator, I understand why it was hard. So we decided that it was more important to create the program and with an eye towards having periodic payments and not insist on that in the beginning.
Yes. Senator Pearson.
So I've got my
Thank you. Hi, Representative Ansel. I'm curious, there's a lot to like in the proposal for sure. And, but it's hard to pick between proposals. There's a lot of decent ideas out there, some around children and families, some others. And I'm assuming, as you've described, you have thought through a lot of that. One of the ideas is child care tax credit to directly impact the high costs of child care. And businesses are always asking, lamenting how difficult that dynamic is. So I wonder if you could just comment on that, the choice that you've made there, and then also to the extent you can help us remember how this fits. We're in a multi-year process, particularly around childcare, and I guess that's one worry I have is we've sort of taken our eye off of that prize. It will have a big price tag when it concludes, and this structure doesn't address that price tag directly, whereas a child care tax credit might. So I wonder if you could comment on that, please.
So what I know about the child dependent care credit is that it's much more narrow. It's hard, it's harder to do sort of the application and the and as a result, it's very underutilized, and it has always been underutilized. The people who use childcare have young kids, so they'll benefit from this. People who work in childcare centers, many of them have young kids, certainly not all of them do, but many of them do, and they'll benefit from this. And there is something, and I guess I go back to my early social work days, there's something about putting money in people's pockets directly that just we're not doing now for the most part. And that seems pretty compelling to me. So I don't see this as taking the place of the initiatives that we have in, and with respect to childcare. But I do see it as supplementing that effort.
Thanks.
Okay. Any other questions? Thank you.
Actually, thank you.
One final question. The amount involved is a little under $50 million. If you only had $35 million to spend and you wanted to concentrate on a program like this, how would you change the program that you planned?
So I'm not going to negotiate against myself because I've learned that.
Darn.
She didn't fall in your trap,
Giving me the opportunity to do that. I think 35 is too small, but I guess what I would say is that if there and Senator Cummings and I had this discussion earlier, if our budget accommodated this, if the Senate budget doesn't accommodate this, I just want the discussion to also look at other things that we might not spend money on. This is a tax expenditure. It's not only a revenue initiative. And so if you're trying to find money for it, you could do it by cutting it, which I think would be unfortunate. You could do it by raising revenue, which I think won't happen. And you could do it by maybe not spending on something else. So I think there are different ways of going about that. Is that fair?
That was very well done. I
But at money chairs.
Yeah, we did.
We need a less expensive, a less experienced Ways and Means chair for the future.
And Senator Kitchell was also there
Yeah.
one shot, and Representative Hooper, so we got all sides out.
Yeah.
Okay,
Thank you.
thank
Very
you.
much. I really appreciate it.
Okay, so next we have Jillian Nigel. She was here.
Senator Jillian was with Sean Brown.
She was with Sean Brown. Okay. I was wondering what I was supposed to ask her. All right. So Catherine is here from JFO, and she asked me what we wanted her to talk about. And I said, I think yesterday there were questions about, you know, why weren't we saving some of this money? Why was everybody spending all of it? Could we put it in reserves? And does anybody else have questions at this point they'd like Catherine to talk about? Okay.
Sure. So I'm Catherine Benham with the Joint Fiscal Office. And I guess what I would, and the big picture concept in my mind, that Finance Committee and the Appropriations Committee really work as a team. You know, you each have your own set of topics you cover, but you impact each other. So I would say as you raise money or or reduce money, it affects the budget and vice versa. So it's a collaborative effort. So you could collectively choose to reserve funds. You could collectively choose to, it's really a joint decision between what you're going to spend and how you two are both navigating this year. And in prior years, you had to navigate raising taxes. You haven't often been in this position where you've been able to offer things like this. So and in those cases, it's been an ongoing discussion between the two. So I would say in this case, it's very much the same thing where you all could certainly think about what your priorities are, understand what the budget is spending money on. I think that's a fair question to ask. What is the budget funding that in the Senate? What are the differences between the House and the Senate? But you all also have to decide what you want to do. So it would be a joint discussion is my mind. And I think if you talk to appropriations, they're feeling obviously lots of pressure to fund things that they value and but that the legislature values and that's the ongoing dialogue as you negotiate with the House and then also with the governor, what the right balance is between tax expenditures, taxes, how you spend money, and how you provide assistance to Vermonters, whether it's through tax expenditures, whether it's through appropriations. Does that help at all? I don't know if that answers your questions.
And I think I can say that the chair of appropriations was working on the assumption that this committee would just go with the $48 million proposal. When I told her yesterday, there was real concern here about raising revenue to cover a tax credit in a time of abundance. And that we had asked Graham to come back with some lower numbers that we weren't overly comfortable with spending all of the money we had this year, given the present economic and international political climate. I think I can say she was relieved. There are priorities that are in the budget. I believe Graham gave us a list yesterday, but I know in this, can you see me for a few minutes?
It's a question about the committee, so I need to check in if you're able to take a break.
Can we take a break at 3 o'clock? Do you need to see me right now? Okay. Now, you keep going. All right, why don't we take a 10-minute break? That would work.
And